Greetings, everyone. This is Dr. Weaver, and I am coming to you to have a discussion with you regarding palliative care or hospice care. We will also be discussing respite care, grief, essentially end of life, death, and dying. So I am going to provide you with a PowerPoint presentation on this topic. All right. As a side note, the school where I came from, we actually taught much of this around the, I want to say, Adult Health 1. But it certainly is appropriate for this particular term because we are dealing with, as the subject or the topic of this course is complex healthcare. And of course, the more complex one's health concerns are, the more at risk they are for death and dying. So I'm going to go ahead and start sharing my desktop. And if you can just follow along with me. All right, and hopefully you can see that. All right. Now, so everything that has been presented to you basically was foreign when you first learned about it. The skills you were taught, the questions you had to answer on all your exams, everyone in this room had to practice them. End of life, death, and dying are a little different. Many of us have lost loved ones, friends, family members, pets. We all have experienced some form of loss. When I am going over this lecture, I want all of you to think about what it means to you, how the information relates to what you have experienced in your life. It looks like my pointer is not working, so let me try this. All right. So these are just a few objectives that I want you to consider as we go through this discussion. The first one is learn the 5 stages of grief according to Kubler-Ross model. Identify developmental stages and grief. Demonstrate effective therapeutic communication when interacting with patients and their family members during end-of-life care. And also understand the differences between hospice, palliative, and respite care. You may have noticed I put a little emphasis on palliative care, more specifically palliative. When you first look at that word, it would appear that you would say palliative, but it's actually palliative. All right, this is the way you will pronounce this particular concept, which we will discuss further in detail. Oh, actually, now I see why I did that. All right. Actually, I was clicking on the wrong screen. All right. So, what is grief? Well, first of all, let's talk about loss. Loss is essentially an undesired change or removal of a valued object, a person, or situation. Loss can be the death of a loved one, the breakup of a relationship, a divorce, the death of a pet, the loss of property like cars or houses, as in, let's say, hurricanes or natural disasters. There can also be loss of identity as well as loss of independence. Think about your elderly population. I mean, they were independent for so many years, and as they get older and they begin to lose certain functions, if you will, sight, their strength is diminished, um, and so they tend to lose independence, especially those who have psychological issues. They then begin to depend on their family members or some other support system. Now, grief is how we deal with that loss. Grief does vary from one person to another. It all depends on how much meaning a person attaches to that particular loss. So you can have two people experiencing the same loss, but grieving in completely different ways. It is manifested in different ways. Some clients will go through a period of anger. There can be sadness, guilt, regret, and not necessarily in that order, or even a combination of these manifestations, if you will. Grief is essential to psychological healing following a loss. Now, factors affecting grief. There is significance of the loss, and we will go through each of these. The amount of support for the bereaved, conflicts existing at the time of death, circumstances of the loss, spiritual, cultural beliefs and practices, and also human development. As far as significance of the loss, what is the meaning that this person has attached to the person or object that is gone? This will be different for each individual. The more attachment to the relationship or object, the more difficult the grieving process will be. The amount of support for the bereaved. What kind of support system does this person have? The more emotional and psychological support a person has, then the less complicated the grief is. Right? And then we have conflicts existing at the time of death. There might be unresolved conflicts, such as an argument, saying things that we shouldn't say, which may prolong the grief, that grief process due to the fact that these patients, or excuse me, these clients would typically have possible guilt, these unresolved issues. And then we have circumstances of the loss. Was it a violent death, such as suicide or homicide? Or was it an anticipated death, for example, a terminal illness? Did the person have an opportunity to prepare for the death? All right. Could the death have been avoidable? Now, if the circumstances surrounding the death leaves the person feeling guilty or responsible, the healing process can be prolonged and more difficult. Um, Also, common and natural disasters when a person loses his or her home, getting laid off from a job, when they are the breadwinner of the household. These are some circumstances that you must consider as we look at our clients. As far as spiritual, cultural beliefs and practices, depending on a person's beliefs and practices, these can either help or hinder the grieving process. Some people believe in reincarnation, or when a person dies, they go to a place where they are content and happy, while others believe that death is a final act, um, There is nothing more after that, some might believe. You also have some cultures that bereave out in the open with rituals, such as funerals, that allows the grieving person to express his or her feelings, emotions, and pain, while other cultures are more private in the bereavement process. And they prefer to essentially keep to themselves in a more private setting and not express any feelings in public. These are all these differences that we have to consider as we think about our diverse client population. And then the last point to discuss is human development. Different stages, ages of development will display different and unique symptoms of grief. All right, so it just depends on where we are in that human development continuum, if you will. By the way, folks, I'm actually doing this presentation. It's about 1:24 in the morning. I'm in Miami visiting my mother, and during the daytime, it's very noisy in the house. And so I had to make sure everyone was in bed and that this lecture, there would be little interference, if any. Doing this for you. Um, and so hopefully it will make it a whole lot easier because there's so much to discuss. And if I can do a combination of voiceovers as well as some discussions we have in class or virtually, I think we should be able to get through a whole lot of the material. Typically, I get through all of it with that combination of deliveries. And also, as a side note, I will likely cut this PowerPoint in like 20-minute increments of time. Get ready for part two. So we talked about developmental stages and grief. We want to look at childhood, adolescence, adulthood, and also older adulthood. So we'll expound upon those different stages um, here shortly. So, according to Erik Erikson, which I'm sure you all have heard of Erik Erikson before, especially when you took human growth and development and perhaps even psychology. According to Erik Erikson, stages of psychological growth, everyone must achieve certain milestones throughout his or her lifetime. Grief can negatively affect the healthy development of life stages. A person's stage of development affects the grieving process. All right. So, for example, childhood, more specifically, preschool children, they do not understand that death is final. It is temporary, that it's reversible. All right. And then from ages 5 through 9, children begin to understand that death is permanent, but they believe they are immune to it. Weeks following a death, the child may feel immediate grief or may believe that the person is still alive. They may also display feelings of sadness on and off over a long period of time, often at unexpected moments. And then we move into young children. Young children might believe they are the cause of what occurs around them, and this is known as magical thinking. They also may regress to an earlier developmental stage. And then we move into the adolescent, but what we just discussed is essentially childhood. And so then we move into the adolescence. Um, there is a sense of guilt and unfinished business. Bereaved teens faces psychological, physiological, social, academic pressures, but they are not emotionally mature. They may be expected to act like an adult and support a parent or younger siblings. When they feel this responsibility, they do not have the opportunity to mourn themselves. Coping may be more difficult if the death is sudden or unexpected. Adolescence can be a difficult time for dealing with one's identity. They're struggling to learn who they are by breaking away from parental control. I mean, we all understand that as we were adolescents before. Now, moving into adulthood, uh, these folks in this stage of development cognitively are able to understand the nature of death and have usually experienced other losses by this time, maybe even a parent, a sibling, if you will. Excuse me. Over time, the loss is perceived as just a normal part of life. Their response to the loss depends on factors such as his or her, or their rather, self-esteem and availability of support systems. So support systems, as you will begin to see, it would be a rather common theme, if you will, or common thread. Support systems are extremely important as we take care of our clients. Now, older adulthood. Uh, it's difficult for this age group because by this time, as you can imagine, they have already experienced so many losses: parents rather, siblings, close friends, co-workers. It just runs the gamut, depending on the age. And actually, by 40 something, 50 something years old, you'd be surprised of the significant loss that we experience. They are likely to lose friends and siblings in a rapid succession, actually. Now, also, they have physical, functional, and independence losses as well. Um, and so the cumulative effects may be pretty devastating for this group. I think I got about 5 minutes before I have to end this one and start another one. Now, this is someone that I mentioned earlier, Kubler-Ross. Kubler-Ross is responsible for the theory, this 5 stages of grief and dying. And I don't know if you can see this. Oh, there it is. So the first one is denial. Hopefully you can see this come through on the PowerPoint. There's denial, there's anger, there's bargaining, depression, and there is acceptance. And it is so important that you guys hone in on these concepts and how to be able to recognize it as you evaluate or assess our patients in a clinical setting or otherwise. See where they are, right? Now, Kubler-Ross's stages of dying are behaviorally oriented. And again, there are 5 stages. Denial. Now, this could be when the patient first gets their diagnosis of a possible terminal illness. They say they don't feel that bad. The test must be wrong. These are the things that you might hear them say. They act as if nothing has happened. They find it difficult to believe or may not believe it at all. All right, so understand that when you see these manifestations of these issues with your patients, you know that they are in denial. Anger is the next concept. How could this happen to me? You may hear them say. Why me? Right? I don't believe this. This could be more aggressive in younger people. All right. The individual resists the loss and may strike out at everyone and everything. And then we move into bargaining. Just let me get to see my daughter or my son get married, right? They're bargaining. All right. Before I check out of here, um, essentially, all right. So the individual postpones awareness of the reality of the loss, and they may try to deal with it as though it can be prevented. I would do anything to change this. It's something you might see in these clients. As far as depression is concerned, now this could be the longest stage. The patient knows they are dying or that they're going to die. They may become withdrawn. They may feel overwhelmingly lonely. All right. This is an important stage because they are getting everything together and in order, wills and such, insurance, and what have you. They may not want anyone around them, isolation, essentially. This stage is when bargaining fails. But this is an important stage to consider. It prepares them for acceptance. And acceptance, of course, is the last concept in the 5 stages of grief and dying. They accept the loss and begin to look to the future. All right, folks, I'm going to go ahead and end this presentation here. They have to be in essentially 20-minute increments because they don't want us overwhelming you all too much with too much information. So stay tuned, and I will be back. I'm going to stop sharing. All right, so I'll stop sharing. Let's see, I'm going to stop my recording.